All right, when it comes to myotomes, we've got the preferred ones. And so one of the things I want to talk about first is that bicep is taught at a lot of schools, but it's C5 and C6, so it doesn't discriminate whether you're doing C5 or C6. So you can do it if you want to, but you're wasting your time. Okay, so it's your time to chew up. You will get full credit, and you will get good information if you just do abduction. That's C5 and nothing else. So I want you to put your arms up like this. I want you to try to hold them. I push. I wait a second or two. He's going to be strong in both. Now, if he's going to feign weakness, remember he has to fake it, so he has to think it cortically and then fake it. So you're going to, this one's going to be weak. So I'm going to push down, and then you have to let that see. But he's got to, okay, not this one, that one. Exactly. So you've got to give your patient time to fake. If it was real life, they'd immediately do it. So I want you to realize, put your arms up like this, wait a second or two, and see if they fake it, and then you know what you've got. All right, so that's C5. Now C6, I want you to put your arms up like this and pull your wrist back. Now you'll want to stabilize the patient on this, and you don't have to pull hard. And be careful that you're not getting into breast tissue. So, you know, usually I just place my arm like that so that I'm careful not to get into breast tissue, but I have now tested C6. Now I have you flex your arm, and this we do this way. Okay, so now we've done C5, C6, C7. The next thing I'm going to have you do is grip your fingers like that. Good. Now grip mine nice and tight. Good. Now spread your fingers out. Okay, and interlace them with mine. Now squeeze those. Squeeze them. No, this way. This way.
Oh, okay.
Okay, squeeze like that. Okay, that's okay. Okay, and just work with your patient. Okay, you let go. Let go. Let go. All right, so, okay, he's pretty strong. All right, now, so now let's review what we did. So we did C5, C6, C7, C8, T1. And that's all you have to do. You don't have to measure them. You don't have to do them 3 times. You don't have to be against gravity. I know lots of you got a lot of paranoid rules out there, but we're just quickly doing them and screening them to see if one of them is weak and holding it long enough for them to fake the weakness for us. Now I want to talk about the lower extremity. So go ahead and lay down. You face there. Okay, and I think they can see all this, can't they, Dr. Laura? So the one thing that I want you to think about is what's the fastest, easiest way for me to get points, and what is the easiest way for that patient to fake it for me? So if I just pull on his whole foot, pull that towards your chin now, pull your whole foot up, that's L4, because that's tibialis anterior. If I just put my hand on his big toe, pull that towards your chin, that's L5. And if I have him push against me, that's S1. Now, how long does that take? Pull up, L4, pull up, L5, push down, S1. Okay, now I know there's inversion, there's eversion, you can clarify them, you can do more testing, you can, but I have all my points and all my information for part 4. So if you want to improve these things and add some things for practice, by all means do that. I want you to be better doctors, but I also want you to get all your points in 5 minutes on this test, okay? So I've given you the easy ways to do it. And if you'll notice, the patient is supine on the table, and I am not crawling on the floor. So L4, pull up, L5, pull up, S1, push down. Now, what would be a wise idea at this point is to go wash your hands now before you do the next things if they're anywhere on their face. So remember, in every room, hygiene may or may not be a point, but it's absolutely appropriate. All right, I want to talk to you about heel walk and toe walk. Now, heel walk can be for L4 and L5, but L4 is so rare to go that L5 is more likely with the L4 disc and S1 nerve with the L5 disc. So typically we just say heel walk, toe walk, L5, S1 nerves. Now the thing I want you to do is have the patient stand up, and they're right next to this. I want you to come to this end of come to one end of the bench and face the other end. And what we're going to do is have the patient walk on their heels this direction. Then when they get up here, we're going to have them turn around, and we're going to have them walk on their toes as they go back the other direction. That way if they get unsteady, what can we do? We can sit them down. Okay, so make sure that anything that you're doing is done right close to this table so that people, if they get unsteady, will land on it. We've had many patients land on the ground, and I don't want that to happen to you. Alright, so now we're going to, one last thing I want to talk to you about, and that's Beavor's test. Now remember with Beavor's test that the umbilicus itself is T10. Above the umbilicus is T7 to T10, okay, right? And below it is T10 to T12. So I'm looking at his umbilicus to see if it deviates at all as he does a sit-up. And you can hold their knees or whatever, but wait, too fast, partner. Okay, all right. Just initiate the sit-up. Don't come all the way up, okay? And that's all I need. Okay, and go ahead and relax. So I watch his belly button as that happens, okay? So enough said, we're done with that. Okay, go ahead and sit up, put your gown down, okay, and just sit right there for us. Okay, get comfortable. All right, now the next ones that we want to show you are the reflexes. Now remember, when we're doing a reflex, we're going to hold this nice and tight. So, you know, it's not like you're going to whack him with a hammer, though. It's just one hit. Now, remember, Tanel was multiple. Okay, so let's just refine this a little bit. When you do this one single hit, I want you, okay, to do it one time and stop. If you felt it, great. If you didn't, you don't care. So do you see where it says ignore the response? Do you see that? Don't worry about it. Because you can't fake deep tendon reflexes. Now, if they really exaggerate and go, wah, okay, maybe they're trying to tell you it's an upper motor neuron lesion. Okay, that one I get. But really, you can't fake a weakness, because you'd have to teach somebody how to contract and fight it and fake it, and it's just too hard to do. So they don't attempt it. So usually the reflex is done or asked for outside of where the problem is. In other words, if they have a C6 nerve root problem, they'll probably give you a C5 deep tendon reflex to do. Okay? So everything should be normal. So here's what I want you to do. I want you to find it, tap it once, find it, tap it once. That's it. One time. If you felt it, great. If you didn't, so what? Okay, so that's the rules. Alright, so that was C5. Now if you'll notice, I hit it with the point. The reason I hit with the point is because I hit me, not him. So I find the tendon with my thumb, and I hit me. I find the tendon with my thumb, I hit me. Now, if you feel like it's a female and there's breast tissue, you certainly can walk over there and do the other one so that you're more comfortable and you feel like you're not invading their space. So you'll kind of sense what's the right thing to do. Now, on the next one, realize that we did this one like this. What you want to do is make sure that the thumb is up for the next one, and you'll palpate the brachioradialis muscle in here, okay, because it's got muscle girth, and then you hit tendon about halfway down. Turn, use the flat part, and that's what you tap. Okay, again, thumb up, tell them to relax. That's it. So when I hit me, I use the point. When I hit him, I use the flat. Now that's typically the rule. There's only one exception in the whole thing, and we're going to do it next. The next one is the tricep. And even on somebody as thin as Ben is here, okay, there's still a little bit of meat in here, a little bit of girth in here. So we tap through that once with the points. Okay, so that's the tricep. And then remember, we go over and do the other one. Alright, now there is one that we sometimes don't talk about a lot, and that is the cranial nerve 5 jaw jerk up here. So to do that, we have the person drop their jaw just slightly open. We put our thumb here, so we're going to use the point and just tap. Okay, so just one tap, and that's it. And don't do it hard. Practice it a few times so you're not hurting anybody. Just a light tap on your thumb, because you really almost don't want to really initiate this one, because you do have to do a pretty firm tap to really make it go. And now we'll do the lower extremity ones.